SFAC has been advocating for safe families for children for close to 20 years in around 47 countries, including places such as Brazil, Paraguay, Cambodia, Lesotho, Myanmar, Morocco, Indonesia, Romania, and many, many more, from small organisations to governments and to judiciary. As you've listened to the needs and concerns of people in the field, what can you tell us about common misconceptions to reintegrating children with families or common mistakes we make in the first year of transition?
First thing that comes to mind, it won't happen here. It can't happen here. Why? Why can't it happen here? Because culturally, relatives and villagers have raised children when they've not had parents. And so it has happened there, but I think you might be misreading what we're talking about and misunderstanding what we're talking about. And the fact of the matter is, it's already been happening there. You just don't call it kinship care or reintegration with a relative or even to birth parents. So lots of things like that where people have said, almost in every country, and again, mentioning Uganda, I remember a great guy, done a lot of work with us. When we first started talking about this stuff, he just said, not in Uganda. It's happening in Uganda. So a lot of things. What's wrong with our traditional methods? What's wrong with them? And then moving on, once they're aware of what we're talking about, maybe understanding what we're talking about, thinking, well, how do you do that? Will it work in our country? So training staff, I'm just finding a few things out here, just training staff. In my years of residential care, working in England, I struggled to think of much training I had at all. And I was thrust into looking after a group of teenagers, 18 teenagers, far older than my own children. So I got no experience working with teenagers. And yet here I was, without any training. Incredible lack of support. Didn't exist. So I think issues like this are crucial.
Yeah, and I think it's about reintegrating children is not easy. No. You know, and if we are thinking it's easy, then we're doing it wrong. You know, because it's about we're making critical and crucial decisions for children, and it's going to impact their life and their future. And we have a responsibility, because we've chosen to look after the children, if we're running a children's home, that if we're then looking to reunification, we're taking responsibility to make sure where we move them to is going to be safe. You know, and that requires in-depth assessments, and that requires training if we're going to do it well. You know, when I started off as, you know, in the children's home, like you, didn't have any training. You know, I'm making it up. When I first became a social worker and I was doing cases of reunification, you know, I had to have a senior person with me to know, am I doing this well? To learn and to gain experience. And I needed a lot of training. You know, we know that reunifications can be unsafe. You know, and sometimes we will make decisions that are not going to be great.
I think, if I can just jump in there, Dan, I think that's an interesting one, because there is a lot of assumptions, and this used to be the case in England, it probably still is to some extent, that why would family be unsafe to reintegrate a child to? You know, they're family. They're blood. Why would they hurt their own child?
And I think that's part of it. In some ways, we're almost a victim of our own narrative, in that we've been pushing this movement that, hang on, we've lost family care, we've lost caring for children in families, and families are amazing and they are incredible, and they're an incredible place for children to grow up and to thrive. But that, I think, sometimes means that when we look at reintegration, we think, okay, well, families is perfect, let's send them back. And we forget that actually, if a child has been away from their family, sure, that biological connection is still there, but things have changed. The family has changed without that child living there. The child has changed without living in that family. And if we ignore that change and we don't prepare the family, we don't prepare the child, and we just make an assumption, as you said, that family is going to be best, then we're setting them up for failure. We're setting the child up for failure. We're setting the family up for failure. And there is so much more involved, I think, in reintegration than people actually realise.
I'm just going to come in there. Especially when you need to understand the reasons for why the child came into the children's home in the first place. Yeah, you know, if that was about a family saying, well, we thought the education would be better, or they'd get a better diet and better healthcare, then reintegration is likely to be more successful going back home. But if that actual reason was because of significant issues about neglect or about concerns of domestic abuse or sexual harm, then reintegration becomes much more complicated. And we have to be much more cautious. We need to ensure, first of all, that a child is going to be safe wherever they are going to live. And not think that because everyone's doing reunification, we need to do reunification for every child. Not every child will be necessarily suitable for reunification.
And when we're talking about reunification, are we talking about reunification back with parents or reunifying children with their extended family? It's like primarily we should be looking at parents. Of course, that's where the child came from. But it may be, as you say, Caitlin, that the family profile has changed significantly. What do I mean? Well, maybe dad's run away and mum's got a new guy. And so we're now thinking about reintroducing the child back to their family that's got a new guy in the family and maybe had children with them. And this child isn't his child. Is there an issue of safety there? I would suggest there is. And that's where what you're saying, Dan, about assessment and information before we do reunifications is important.
Yeah.
And I think one of the classic kind of mistakes in that kind of first year is not thinking about the systems that you need to set up and then the training to make that work in the most efficient way. And
are you talking about training of carers or training of staff?
Both. Yeah. Because I think we often just jump and we want to find easy solutions. And actually what we need to do is spend time to make sure the systems are in place so that we know the child and we know the family, and we as professionals or working to do those assessments, that we know the systems and what we need, what information we need to find out, and how to do that analysis. And that's not going to be easy. You can't do that on your own. And I think we cannot expect one social worker to do that. We can't expect anyone to do that in the first time without support, because it's too big a job.
And I think we've got to be aware too that it's not actually just in that preparation phase, it's in the follow-up phase. We can't just send a child home and say, okay, it's done, because how do we know in an ongoing way that that child is still safe, that that child has settled in, that the family is coping, that they're managing that massive transition? We only have to think about it if that was for us. If we were to pack up our bags tomorrow and move to another family, that's huge. As an adult, that's huge. So even if you're moving back to your own family after living away, how are we following up? How are we making sure that they have ongoing support to manage that transition? Because it's not an instant thing.
And we mustn't underestimate the logistics involved in some countries. Yeah. So in one country I was working in, and I asked the organisation, who worked with street kids, I'd been doing so for many years and were really good at it. And I asked them, I said, how do you know, kind of like if your reintegration plan has worked? And he says, well, we find out from the other kids on the streets, because they tell us if the child we placed home in the north of the country, kind of within 6 months or a year later, is actually back on the streets again in the centre. They say, oh, that kid you placed, guess what? He's back on the streets. So that's how you find out. He says, yeah, but if we travel, it's going to be like 3 days to get there. So we have got to be creative, recognising the logistics of actually doing follow-up, although it's significantly important, and it is. We have to think about, be creative in ways we can make that happen, maybe working with local partners.
Yeah, exactly.
And I think the final bit I would say is talk to children.
Yes.
Yeah.
Children can tell you about their experience of life in the family. What are their fears? What are their concerns? As well as what are they excited about? What do they think will be good about it? I can remember, reading one where a child talked about the fact that they felt unsafe back where they were because of the drinking going on in their household that they'd moved back to. We need to find that out both early on in the assessments, But then when we're doing that follow-up, we need to be able to find out if that's happening, then we need to then start to act on that. And how can we help that child and help that family?
Exactly. And I think that comes back to what Mick was just saying too about logistics. So there's the logistics in how do you as an organisation conduct your follow-up and conduct that ongoing support. There's also logistics in terms of how does the family and how does the child access support. So if something goes wrong, if they need help and it's another 3 months till there's a visit, what options do they have? What's the plan in place? And is that plan realistic? Or does it involve child calling an organisation, but the child doesn't have access to a phone, doesn't have access to money? So what are the logistics and how plans have to be specific and they have to be detailed and they have to be practiced to know whether they're actually going to work. So the logistics right through from assessment, what's the decision that we're making? Is this child safe to go home? Okay, we've made the assessment, then preparing the family, preparing the child, making the transition, and then the follow-up support and ongoing support. It's quite a process.
I'm just going to follow up or finish this one just with a comment you made a little earlier, where you said when people sometimes think, well, the child's gone home, job done. No, it's not done.
Yeah, exactly.
There's a whole lot of work after that that needs to take place to make sure that works.